Hello, I'm Dr. Beth Godey.
And I'm Dr. Martha Leatherman. I'm a geriatric specialist in psychiatry.
And I'm a neuropsychologist, and I specialize in aging.
We're experts in dementia care, and we're here to provide you some information and answer some questions that we hear very commonly about dementia and other issues in aging. Hi, today we're going to talk about hoarding.
And hoarding is such an interesting topic, and it fascinates a lot of people. Obviously, because there's a television show about it, and people tune into the show just to see what this hoarding is all about. But actually, hoarding is a very serious matter.
And very complex.
Yes, and it causes great consternation among families.
Mm-hmm. Mm-hmm.
And now, Dr. Leatherman, I wonder if you could sort of elaborate on the different aspects of hoarding, maybe even the different types of hoarding.
Well, not all hoarding is the same. So there are different reasons that people hoard. And one type of hoarding you see in people with chronic serious mental illness like schizophrenia. And a second type can be people who are extremely anxious, and it's almost like an obsessive-compulsive disorder variation where they compulsively save things or obsessively hang on to things.
They have to do it.
They
can't not do it.
Right, and to get rid of anything makes them very, very nervous and anxious, and that anxiety is worse than the mess. And they will say, "This is awful, I know it's awful, I hate it, I can't stand it, but I can't stop."
Right.
So they have that awareness. Then there is the person who's always been, thrifty and saving and puts things away and keeps things and doesn't like to get rid of things, but could, live functionally in the world. And as they get older, their personality type coarsens a little bit, and that behavior gets worse and worse and worse, and they can't stop it.
A lot of times families will interpret that initial behavior of saving things as, well, it's, Mom lived through the Depression. It's
right.
That Depression era mentality. But then it moves into a much more serious form of saving and being thrifty.
Mm-hmm. And if you think of it as a coarsening of a basic personality, where the bad traits really become more prominent. But the most serious kind of hoarding, and the one that probably gets the most attention among people that we see, is the hoarding associated with dementia. And it has a couple of different names. Diogenes syndrome is one name, or senile squalor syndrome is another name.
Squalor being the key word, one of the key words there.
And in people with this disorder, it's more than just the hoarding. There is no shame. And that's a real big differentiator for people. There's also self-neglect where people won't take care of themselves.
Most people will think, well, if Mom can't organize her paperwork and she can't really figure this out, so we're just going to go in on a Saturday and somebody's going to take her to the grocery store, and then when she comes home, the rest of the family will have cleaned the entire house up for her.
And she'll be so happy.
Oh, she'll be so happy. Not so.
No. Because even with senile hoarding and hoarding associated with dementia, there is a tremendous amount of anxiety. People don't want to lose control. They feel safe having these things. And so to have all of their environment changed quickly is not good for them.
And that's true in general. To have your environment completely changed suddenly in people with dementia is not a good idea. But we often will tell families not to go in and clean out everything, but to make sure that they move things to remove obstacles. But as you were talking about, putting things in this special basket. We'll put it in the garage. We're going to put it in this closet. We just want to make sure you can move through the room.
But you're not losing the things.
We're not getting rid of it.
That's right.
We're just putting it here, and then you can slowly, over time, perhaps get rid of some of that.
Well, because remember, if it is associated with dementia, they may not remember that they own it anyway.
That's
so
true.
Out of sight, out of mind. And so you can kind of slowly move things out of the way.
Yeah.
I would say, as a caveat, for the people who have extreme anxiety about their objects and their possessions, and I think of one, for example, who had hundreds and hundreds of latex rubber gloves hoarded everywhere. You don't want to go through and clean something out. It can precipitate such a psychiatric crisis that somebody can be suicidal. So you have to be very careful with it.
Yeah. And there again, you need some professional advice and a good evaluation and some consultation from physicians and specialists to help you make some decisions about how to handle this with your loved one.
But if you remember our conversations on the frontal lobe in earlier installments of the videos, we talked about how the frontal lobe keeps people organized and helps them sequence and plan things. So a lot of times this senile hoarding syndrome, the Diogenes syndrome, is associated with frontal lobe impairment.
Right.
And so they can't figure out what to get rid of. And they can't finish a job. And there's the apathy and the self-neglect, and of course the lack of self-awareness. So they don't have any shame about the squalor in which they're living.
Right, right. So we hope that this puts things in a little bit more perspective for you, because hoarding, as we said, is a very complex issue and very difficult to deal with.
For more answers to questions like these, our book, The Insider's Guide to Dementia Care, is available at Amazon.com.